believe, and I do, I believe in Santa Claus and HRN.
Just out of curiosity, what do you mean you believe in HRN because of everything that we've done?
Everything you've done, yeah. I mean, when I heard about this, I just thought it was a bunch of malarkey.
Right.
But it has helped.
Like, can you give us an example?
Yeah, just like the other day, I had my tube off, and I'm on 3 liters of oxygen, and I got up and I walked 100 feet and didn't even put it on.
Wow.
Really?
And I went up 2 flights of steps, and by the time I got up to the top, I was fine because I walked like they told us to walk.
Okay. And Tyrone, you want to say a little bit about yourself?
Yes. My name is Tyrone Best. I caught COVID back in April of last year, and I'm learning how to deal with my body now. What COVID and what the hospital tried to what they did do, which was keep me alive. Some of the things that COVID did to my body, the doctors, the hospital had to do things in order to keep me here. So it was COVID that started it. My lungs collapsed, and I couldn't. My lungs couldn't keep me alive. It couldn't oxygenate my blood. So I had to go on the ventilator initially, and then with the ventilator not helping, I needed another machine to keep me alive, which was the ECMO machine. So what I'm dealing with is my lungs are scarred very bad, but I just took another pulmonary function test last week, and it shows that my lungs are getting better, improving.
Oh, great.
So I'm hallelujah happy about that. With HRN, what they've done was to help me with breathing and helping me to understand my body now, how to breathe. And then not only that, but the process behind everything that's taking place when we do breathe, how the pressure has to be there, as well as the heat, the temperature, and all going through to press through to the alveoli, so that the oxygen can go within our body and our bloodstream to take care of the muscles that we need and the organs that we need oxygen for. I've learned so much from HRN about my body, and I'm able to talk with other people who are dealing with the same issues with breathing, and I've referred them to the rehab center.
So, out of curiosity, has any of you, anyone have been into an actual, a traditional pulmonary rehab program before?
I had.
Like, did a hospital teach you anything on breathing or anything? Because, like, a lot of times what I see is, as a director for advanced lung and heart disease, I see a lot of times people come in and they, first off, their medication are, they're not even making deposition, meaning that the person's breathing so shallow that those medications are contraindicated according to the FDA. And then I find people that went to hospitals and all they do is they put them on treadmills, and that's it. They put them on treadmills. They don't really encourage any types of breathing exercises, techniques, because I find that when people can't breathe, how can they exercise? Did you ever have to go through something like that where you have, like, maybe a few clinicians in the hospital that try to rehabilitate you within the hospital? Did you learn anything from that?
Did you want to answer?
I didn't.
You didn't?
I didn't. I went to Carroll County. I did the outpatient. And that's what you said, just like you said, the treadmill, and they had the bikes there for you to use.
But they never used any type of breathing techniques?
No, but they
like
never, no.
Nothing like that?
No. They just would say, well, don't let your heart rate get so and so far, high, and that's it, more or less.
So then when it came, let's say let's say I'm exercising and my work of breathing got a little high, or something, they will just have you stop, and
Yeah.
they won't tell you how to control that.
No, they'd just say, well, take some deep breaths, you know. But other than that, that's all they would tell you.
That's it.
Now, they had a line, was about 3 ladies behind the desk
Sure.
that could monitor when
Yeah.
the heart rate went up.
Gotcha.
But that's, you know,
Gotcha.
Yeah.
Gotcha.
For me, I can say it was minimal. And what I mean by that is it was just basically teaching me how to breathe, just breathing in through my nose and out through my mouth. In through my nose and out through my mouth was the basic thing that I got from them. The doctors and all, and the nurses, they're good to give you the care, but the intense and the knowledge behind breathing and the different ways of breathing, they weren't taught there. They were basically just maintaining to the degree that when you could get healthy enough to leave the hospital. Now, the hospital that I was in, they had a pulmonary rehab center,
Sure.
but it wasn't through Zoom. It wasn't a stream or over a Zoom.
Right.
It was a physical. But in my case, during the time that it took place, they had to shut down because of COVID.
Yes.
So I was out of luck in regards to getting help from them. But my doctor, Dr. Shaw, who is another Shaw, referred me to you all. And I made the call. And ever since I made the call, I started learning about me. The doctors, when I was at the hospital, I had lost 70 pounds from being in the hospital for 3 months, battling not COVID, but what COVID did to my body.
Sure.
So I had to learn how to walk again. I had to learn how to brush my teeth. I had to learn how to put my clothes on. So those were the things, the occupational therapy and that type of therapy they were helping me with. But as far as helping me with breathing, no, they taught me about the oxygen tanks that they sent me home with.
Did you see respiratory therapists there?
I did see respiratory therapists. They were coming through on a regular basis.
Okay.
But when I got to the rehab side, I wasn't seeing them as often.
So you were just seeing like physical therapists,
Physical therapists, occupational
speech?
therapists, yes.
Gotcha.
And it wasn't even speech, it was just occupational and physical, which they did well because they got me my muscles working again
Sure.
and being able to walk short distances so that when I did go home, I would be able to maneuver,
Did you-
a little more, a little
Okay.
better.
So, from everyone's point of view, would you feel that when somebody goes in for physical therapy with breathing complications, that they hey Lenny, with breathing complications, do you think it's important to include respiratory therapists that are more strategic, more professional when it comes to pulmonary rehabilitation? Because I always find, especially as a director, I find that some of the respiratory therapists that we hire understand pulmonary rehab, but they don't understand the pulmonary rehab aspect of it, like how to get somebody how to breathe, how to increase intercostal diaphragmatic muscle strengthening, to all sorts of things. Because we teach a lot with an HRN, but it is actually very common when somebody goes into the hospital not getting a lot of education. They usually bring them in and they try to get them discharged as quickly as possible. But then the person goes home not ready. They sometimes they're not ready. Sometimes that they just don't know what to do when they're home. They think everything's fine, but then you have people going back and forth to the hospital because of this constant, hey, let me just put you on a treadmill, and then some people get discouraged because they can't breathe with it. And then when the vitals go out of whack, they just stop therapy altogether.
I can see that.
Yeah.
I can see that.
It's ridiculous.
For me, I had to decompartmentalize things. I had to look at what they were doing for me when I was in the hospital for care. And during the time, I couldn't put it all together because I was in a coma for about roughly 2 months. So once I come to, now I'm looking at everything that's going and taking place. So I have to put things in their proper perspective for my mind.
Sure.
The nurses when I was there were fantastic. And the reason why I say that and what I think was because me being in the hospital on the floor that was totally COVID patients, they saw life and they saw death more frequently than normal, right? So I think that kind of the love inside of them and how they treated their patients was they treated me like a king in there. The love was just overwhelming. So I had to decompartmentalize and put that in its proper perspective. Sure. The doctors and them showing me and telling me about the things that they had to do to me to get me to understand that perspective. And then there was the perspective of the rehab, which was to get me up and running. Well, not running, but just to me to be able to use a walker to go to the bathroom.
You know? Said it.
Right. So with that being said, respiratory, they were making sure that my trach was clean when I was in the hospital and dealing with my oxygen levels and making sure with a pulse ox, they had the pulse ox. I didn't learn about this pulse ox device until I got with HRN, which is, I keep this with me every day so that I'm able to tell more about my body. Though I can tell now all of, how I feel and where my numbers are as far as my oxygen is concerned. But I keep it with me at all times. They didn't teach me that. They told me that I should get one, but they didn't go into the details. And I think that should be added in the hospitals for that to be another step and a deeper step while patients are there.
Oh, sure.
To give them, because it is confidence when you know what your body is doing and what you do to make that happen within your body.
Oh, absolutely. Especially like when you're not knowing what to do, your anxiety goes up, and the brain. For people that don't know, brain consumes a lot of oxygen. Every time you breathe, it consumes about 30%. When somebody has an anxiety attack, it might even consume 60-70% of your oxygen. And if something is obtaining pulling in a lot of oxygen, it's going to give off a lot of CO2. So somebody might be out of breath by overthinking. That's why I usually see somebody with having an anxiety attack. They're like, I'm not sure what's going on. Somebody call the hospital. But they don't realize the brain's just overreacting and they have to calm themselves down. It's hard to do that when you're not sure what to do because let's say you're discharged home and like with pulse oximeters, something very simple. I find a lot of clinicians get this wrong too. That let's say you go into the hospital. You go in the hospital and they put a pulse ox on. They see the first number that shows up, and they jot that down. Did you know that is incorrect?
Yeah.
You cannot do it that way.
Yeah.
Meaning they can't put your pulse ox and look at the first number. Through the FDA guidelines that looks at the class 2 device of a pulse oximeter, they specifically state that you have to wait 30 seconds to allow blood flow to run through because that pulse oximeter is a clamp. There's a spring in it. So when you push pressure onto any surface of your skin, if you do this right now, push any pressure on the surface of your skin, you'll see a little spot where the blood got pulled out because you pressed pressure onto that skin surface. And then you have to wait for it to circulate back through. Because people weren't doing that, a lot of people were diagnosed or they were given a prescription for oxygen when they didn't even need oxygen. They just had slower blood. So and the other thing is looking at it like this: if the brain and heart are consuming oxygen, and the 3 organs that consume the most is liver, heart, and brain, that means if 100% came in and 100% is left over, your body didn't consume anything.
Right.
You know, it didn't consume anything. Everyone wants those high numbers, but that's not really what you want. You don't want 100% oxygen. All right, I haven't seen athletes, like Olympians, like run at 100%. You know, they're down at around the 70s when they're running. I'm not kidding. I physically saw it. You know, and I looked at the sidelines. I was a rookie at that time when I was, when I was still in school in my clinicals. I looked at the sidelines of the exercise physicist and these other doctors, and they're like, no, that's normal. I was like, I thought it was supposed to be above 92. They're like, no. At rest, yes, not during exercise. And he said, when you exercise, your body consumes more.
Yes.
So why would it and if you have to think about it, if the first line of sight is oxygen comes in, goes straight to your heart first. That's always the first place it goes to. Heart consumes 20%. Brain consumes 30%. Liver, heart, and brain consume the most. Then you have your integumentary system, you have your lymphatic system, integumentary is the skin. You know, so you have all these other organs consuming. And you put a pulse ox on, you're always measuring what's left over, not what you bring into the body, because the pulse ox is not located on your heart. It's located on your finger. If you just look at a circulatory system, you're always measuring what's left over. So if 100% comes in and 100% is left over, how much did the body consume? Nothing. Right?
Correct.
The oxygen is staying in the blood, is not being consumed by the organs. People don't realize that internal respiration is very important to understand. Pulse oximetry is very important to understand, because then you have somebody who is diagnosed with a certain disease or something, or some problem. They go home with oxygen, but what the clinical, the clinician did was probably looked at the first number, and they didn't wait that 30 seconds, and they were given prescription for oxygen, and that person goes back to the hospital because they increased their oxygen and wasn't told how to use some of their devices. So yeah, patient education is incredibly important. Now, you were mentioning before, before COVID, for those that don't know, you can obviously look this up, especially on the American Thoracic Society. I obviously converted all this to memory. But in 2017 in May, that's ATS, American Thoracic Society. In 2017, there was only 831 certified facilities in pulmonary rehab to govern people from ages 50 and up. There were 70 million people in the United States that were diagnosed.
Wow.
There's a large, incredible amount of people that are undiagnosed. So 70 million plus people were diagnosed with a severe heart complication. With lung disease, there was like 24 million. So you're combining all that, and 831 facilities. Actually, when COVID happened, they stated that there was only less than 10% left. So all these other places had to shut down. Like, for instance, Northwest, they closed their pulmonary department.
Yes.
You know?
Not only Northwest, Johns Hopkins.
Yeah.
Had to close theirs. I couldn't use theirs.
Yeah, it is just unbelievable. So these people have no place to go.
No place to
They go home, they're like, all right, let me try online, let me try this. And this program, of course, was developed before COVID and it was just in a nick of time that it happened. I hate to say that, but if we didn't come out, I know with LifeBridge, according to the study that was done by Kevin Blyden over at Sinai, there was, I don't remember how many patients altogether. I do remember that the hospital readmission rates dropped down to 2.4%. Instead of having it up to like 30, 40, 60%, meaning people go home after being admitted to the hospital. Most of the time, them going back to the hospital is very, very high. With us, it's actually, it's dropped all the way down to 2.4, and try to look up one facility, any facility that has a less than 2.4, it's impossible to find. So we have the lowest. We actually had a call from Medicare today about, they were stating there is no other program in existence, verbatim, everybody, verbatim. They said there is no, we're just inquiring about, how you guys are doing this and stuff like that. Because there is no program in the United States that does what we're doing. We're the only ones. HRN is the only company to date that is covered by insurance, and it does virtual pulmonary and cardiac rehab. That's obviously through telemedicine itself.
And that's what I was trying to do with my hospital, Johns Hopkins, because I knew that they didn't have any pulmonary, physical pulmonary facility open. And I was trying to facilitate them to send patients to you all because you all were operating. And I was telling them everything that I was doing and what I've learned, so that they in turn would send their patients, to you all. Because if you're not open, then how are your patients going to get the health education that they need, the understanding? So I'm not sure how far that got, but I understood the importance of having their patients come to a facility, or the facility come to them, however we want to look at the Zoom, right? But in regards to the pulmonary rehab work that I'm sure my friend here and I are doing, it has definitely improved our life.
Can you elaborate on
with
that?
it.
Like from walking before you went into this program, how far were you able to walk? Like, kind of give your day-to-day, like what happens throughout your day before you entered into this program?
When I first came home, they normally give you an occupational therapist, a physical therapist, and a nurse. So I went through that transition, but I was on oxygen. I could only walk maybe from my living room to the bathroom, which is probably about 40 good steps. I needed to have a walker when I went initially, coming home. When I was going back and forth to the hospital at Johns Hopkins, and they were talking about pulmonary rehab, but the facility is down. So I got in contact with Dr. Shaw, who is my pulmonary specialist for my CPAP, my sleep apnea doctor. And then with him knowing the importance of exercising and all, he said, well, Home Rehab Network is still going. I'd like for you to give them a call to see if they can help you. And I did. And from there, I've just been soaring.
Were you skeptical about an online program?
Yes, absolutely. I'm glad you said that. Because I was like, how are they going to help me?
I know.
I'm home and nobody's coming to my home. I've been dealing with occupational therapists, I've been dealing with physical therapists, and a nurse. How are they going to deal with my breathing over the phone?
Right.
Video.
Right.
How? And I believe doctors, because I've shared with them that I'm taking pulmonary rehab, but over Zoom. And I see their facial expression first,
Yeah.
and they're amazed.
Right.
Doctors now,
Yeah.
pulmonologists now, are amazed that how are they doing that? And then I begin to explain everything that I'm doing. And
Right.
I have to be true to myself.
Of course.
With doing what is suggested by my therapist.
Sure.
Which is walking 15 minutes in the morning and at night, riding my bike or hand bike or whatever apparatus you have to continually work your body so that your muscles will become stronger and your lungs will be able to expand more. So those were the things that I was telling the doctors what I was doing. They were just like, wow, amazed,
Yeah.
About it. And to see a doctor look like that in regards to the rehab that I'm doing,
Yeah.
and I'm telling them, the benefits of it and how I'm now able to walk, 6-minute walk. I'm doing 1,280 feet.
So before you were at 40 feet, 40 steps, and now you're at
Yeah, I'm doing 1,280.
1,280 steps now.
Yeah, that's what I've done. Just past 6-minute walk test.
And did they find out with like a pulmonary function score how well your lungs are working out now?
Yes. What's funny about this industry? It is.
I love it.
It's funny. Yeah. Certain doctors don't want to share certain information about you. That's so bizarre for me. When I'm looking at me and I'm trying to be overall well, I need every doctor that's dealing with me to see all my information regardless. And I've seen where some doctors are not willing to share some of the information about you
Sure.
to another doctor, which is, it makes me not want to deal with that type of doctor.
Of course.
Who doesn't want to share the information. I don't know if it's a pride thing or what, but you guys need to share the information from one pulmonary doctor to the cardiologist, because I have them all. I've got every aspect of the doctor.
So would you say that? So would you say that no two doctors are alike?
No two doctors are alike.
So it's like finding the one doctor that actually would not just necessarily care. I'm not putting down any doctors. What I'm just trying to say is that there are other doctors that are a little overwhelmed, and there's doctors that are very passionate in what they do, and finding that passionate doctor sometimes that they don't look at a patient as a number, they look at him as a person.
That's a good one.
Yeah.
That's good.
That's what you want to find. You want to find that, hey, you go into the office, doctor knows your name without even looking at your chart. Hey, Alex, hey, hey, Tarda, hey, Lucinda, just knowing your name instead of, oh, patient number 15678, it just feels like it's.
But the other thing too?
What's that?
That you have to fight for your doctors to maneuver your information like you want them to. And if they don't, you get the data and you give it to your doctor. You have to take control at some point about your well-being as an individual. You can't always leave it up to everybody to do it for you. You gotta use some common sense and want to live and be better, so that you can, go up the ladder as being.
Very good, Lanny. She said, be your own advocate. Absolutely. Lucinda, do you want to elaborate on this? Before you started with us, tell us a little bit about what was going on, type of thing. Before you went into HRN.
Well, it started that I had worked on a Friday night, and by Saturday night I was admitted to the hospital because I couldn't breathe.
Sure.
And so from there on, then they brought, when I went home, physical therapy and all these. And so we went through that, and I really didn't feel like I was, had gotten anywhere. So I was back in the hospital again, one of many more times. And so they said somebody said something about HRN, and I thought, I got to give them a call. And I gave them a call, and it was only a short time I could start feeling a difference. And of course, I've been hospitalized a lot of times, and they'll throw you back. But you can't give up. You just got to keep plowing through it, Sometimes you feel like giving up, but you just can't do it. I mean, you got to pick out a reason why you can't do it. And that has helped me along a lot. And well, just like I said I went up those steps. I thought, well, I'll never make it.
Sure.
And then I thought, I got to do it. And I did it, and I shocked myself.
Did you know you didn't have the concentrator on at that time?
I did that time, but I had walked 100 feet
Before you knew.
Into the laundry room and back over to my part, and I didn't have my tubing on. The machine was running, but I didn't have it on. And when I saw that, I thought, oh my, what did I just do?
Sure.
And I got along well.
How far could you walk before?
It wasn't very far. I mean, I could walk from you had been at my house.
Yeah.
From the door over to the door where you would go over.
And that was like the max. So
And that was about the max I could go. And that's only about 25 feet.
25, 30 feet, something like that. And now, what are you doing now as far as what you...
I didn't do so good on this last test.
Sure.
Because I'm just getting back into it again.
But since being with HRN, what's the furthest you've walked?
Oh, Lord.
Without stopping?
I can't remember. It was up over 1,000.
It was up over 1,000?
Yeah.
Okay.
And I think it was closer to 2,000, really.
Really? That's really, really, really,
So
really,
I,
really awesome.
I mean, and Dr.
Sure.
Shaw, I said I did something. And, on the meter that we blow on.
Oh, the incentive spirometer.
Yeah, I said about I had blown 2,000 on there.
Mm-hmm.
And he says, wow, he says, as little as you are, he says, that's good for you. He always knows where to throw something in.
Oh yeah, always does, always does. He's a great doctor.
He is.
I mean, like there was a lot of doctors that I was trying to partner up with, and when I mentioned this to some of the very prestigious doctors, that I can't mention names, of course, but one in particular that I really wanted to for this doctor to be a partner with us, because I looked at this person, at this doctor, very highly. You know, I kind of wanted a mentor in a sense, and this doctor kind of just looked at it as a business, and so that fell through. And then I mentioned this to Dr. Shaw when I was director of over at Future Care Cherrywood. I mentioned this to Dr. Shaw, and he says, "Let's do it." Like without question, just said, "Let's go, let's do it." And you know, he didn't care about getting paid. He didn't care about anything else. He's like, "Let's do this." He says, showed a lot more passion, a lot more like emphasis on patients. And you know, I remember the one thing he told me, which I'll never forget. There was a he was talking to a nurse, or it was a nurse. He was talking to a nurse, and there was I believe it was a nurse practitioner, and the nurse practitioner, I believe, wanted to put this person on hospice. And he said, "They're still a human being." And when he said that, like, no one cared about it, but I was like, that's the person I want to fight with. That's the person I want to fight for, you know, like with, as we fight for these people to live, you know. People are getting scared. They're going home not ready. They have nothing in front of them. They just have, you know, like hope. Yes. And that's all they're striving for, instead of, you know, instead of like actual help. You have clinicians now. You have an assigned clinician. You can call your assigned clinician. You know, that's what should have never been taken away. We should have never, you know, a lot of these hospitals should, and I understand the reasons why, but we should have never taken pulmonary rehab away. And of course, we're always going to be here to stay. You know, that's just the bottom line of it. But you know, like walking to, do you do your own shopping now?
No, they don't want me to go out on account of all the germs, you know, the flu and all of that.
That's very important, because I heard that flu is not
you know,
going crazy.
My daughter says, "We want to keep you alive." She said. So, you know, I mean, this is just the way it is. We was talking about going to a church service, and
Sure.
she says, "But you know," she says, "I forget how many hundred people is going to be there."
Yeah.
And she says, "I don't think that's good to take you in the middle of all of that."
Sure, sure.
And she says that they would have it televised, you know, on Christmas Eve or Christmas Day. And she says, we can watch it on television.
I have to admit, your daughter is a fighter.
She is.
She is very, I mean,
I think Dr. Shaw's really impressed with her, too.
Yeah, she is a fighter. It's always so nice to see family members. You know, sometimes family members can actually be harsh. You know, like if you hear from a stranger, "Hey, I don't like you because of this," but you get that from your family member, it hurts 3 times worse.
Right.
You know, and but having a family member like that, those are the people that you definitely want to be around.
You know, this was the quirky part about COVID.
Sure.
The family member couldn't be there.
Yeah.
The family member wasn't
That's
there.
absolutely
Right?
true. Absolutely.
And we look at, you know, when what we know about the hospital is you can visit your family members, right? And you can rub them and talk to them and give them, breathe life into them with words and with scripture and all, right? But at this time, we couldn't have anybody in the hospital.
Just slip through the window.
Yes. So all of this madness is going on. people are sickly and the family members are home, they're sickly mentally, right? From worry and the anxiety and all from it, right? Here we are, a whole world dealing with this thing, but let's just deal with the United States. All of the displaced anger from people losing people. People lost people. They couldn't even see it. The only way that you knew was from a phone call.
A lot of people were saying that COVID was fake.
Yes.
I couldn't believe that when I heard that. I was like, are you kidding? He said, oh, it's all publicity. I said, people are dying left and right in front of you. What do you mean it's for, it's for what is it? It's capitalism? People are dying. It's not capitalism. It's literally just, there's no one else there and you're alone and scared and,
At one point, they were saying that it was mainly for people of color who were catching this virus, and it was killing the majority of them, and just people who were overweight or who had issues prior and all. That was not true. It depended upon who that virus jumped on, and then it started doing whatever it wanted to do to the body itself. Yeah, those who had other issues were more susceptible, to getting sick. But there were several who were not sickly and who caught COVID and didn't make it because of what COVID did to the body itself. I just remember that folks couldn't be there, and that was painful. And now with all of that grief, right? And I know this is a little step away from it, but we're talking COVID and we're talking hospital.
Yeah.
That there are so many people out there who are hurting because of them losing mom or dad or sister or brother or just a friend who was like a brother or a sister. And if you don't know how to handle the grief can become anger. And anger can leash out and lash out towards other people. And in this time, we got some real anger issues going on in this United States.
Yes.
The news that we see.
Oh my goodness. I think, I honestly, especially I'm hearing more and more clinicians leaving the field of medicine. There are a lot of clinicians are just leaving the whole thing of just medicine. And I was like, guys, everybody, we need each other more than ever right now. Yeah. We can't segregate ourselves. We can't just because it's we're clinicians. This is our job. We need each other more than ever because left and right. You have people just falling. Just jumping off their, I don't want to say bandwagon, but they're jumping off of their hope. They're saying, oh, everything's all over. That's it. Some clinicians don't want to go back into therapy because they have to wear a mask or something. It's like, just help out, because now I believe the ratio of pulmonologists are about, I think it was like somewhere around 3,000 people to 1, like 3,000 to 1. Like the clinicians out there are going, it's just not, they're just not there anymore. They're leaving, they're resigning and things like that. And I think at this day and age, we need each other more than ever, and you go out on the roads and everyone is just so violent. You're hearing shootings and you're hearing this and that, and you're trying to get from point A to point B, trying to get into a facility or something, and it's like literally impossible sometimes.
So let's look at this, and I'm just adding just a tad.
Of course.
Now let's look at our police departments, right? Every time they get a call on the radio, they don't know what they're going into.
No, they don't.
They are. So do we think that they're going there casually? No. The adrenaline starts to flow, and all of these things within the body start to react, right? You running through your mind how to handle a certain situation, and you're not even there yet. But then when you get there, and the situation is what it is, whether it's a big situation or small, now you have to make even another change to calm down, calm down the situation, or you have to step up and do even greater than what it is you thought when you were riding there.
Sure.
So with that, day in and day out with our officers, they need help too.
Oh yeah.
They need some mental health checkups on a regular basis.
Sure.
And I do not think they're getting that much, in my opinion, but they're dealing with so much.
Sure. Sure.
And it only takes an issue that he can't get out of his mind, and what do we have? We have another incident.
Of course. Of
based
course.
on, you know, everything that's going on. So I think we have to care, like you said, about each other.
Oh yes, absolutely. Out of curiosity, what type of exercises are you guys that you find more beneficial, especially for a lot of the viewers right now? What type of exercise do you feel is extremely beneficial to you that you find that not necessarily is just very appealing to you, but that worked best for you? Was it the respiratory muscle training? Was the walking and breathing?
Walking.
Like, did you feel that the education was the most important part? Like, what? Like, give me an example. Lucinda, you want to go?
A lot of the things, okay, a lot of the things that we was learning, you know, you all use bigger words
Sure.
than what I'm used to.
Sure, sure.
So I didn't understand a lot of it.
Yeah.
But I think the walking does much more than anything. And, you know, it's just remarkable, you know. I mean, the way they can get you to do this.
Absolutely.
Because I had, like I said, I had nurses in rehab to come to the house. Well, they didn't tell you how to breathe when you walked or
Sure.
anything else like that.
So let's say you were about to get up. From what you learned from HRN, you're about to get up. You're anticipating you might be out of breath. What would you do now?
Take a deep breath.
But you were purse lip breathing. Okay, so purse lip breathing. How do you know your purse lip breathing is the right purse lip breathing? Like, how do you know it's the right pressure? So we usually teach a tissue technique
Yeah.
to know the right pressure, because we found out people that purse lip breathe that, and that's just one technique of so many. But you find the people that purse lip breathe are not doing it right, because they're just actually just breathing. It's not really, they're just doing this in style where they purse their lips, but they don't realize the pressure is very important. You want to go from a high pressure to a low pressure,
You know, so
Well, you want to take in as deep of a breath as you can,
sure.
and then you go.
So you purse
blow
lip
out
breathe.
Very hard,
Okay.
and you hold a Kleenex out in front of
To
you.
know your pressures.
And if that wiggles, then you're.
I like that wiggles, yeah. So when you take one step, then you breathe in, one step, you breathe out. Like, which one do you use the most, do you feel? Like when you have to walk?
I mean, right now.
Yeah.
The breathing.
So, like, give us an example. You mean like one step you're breathing in, one step you're breathing out? You
Yeah,
found that
pretty
more
well,
helpful?
yeah,
Okay.
pretty well.
Okay, all right. What
And
ab-
sometimes it's 2-to-1.
2-to-1, yeah.
But-
like 2-to-1 ratio?
Yeah, and now this week I did a load of laundry.
Sure.
You know, my daughter, thank God for her, she fixes meals in the evening, and she'll fix me a plate upstairs and bring it down to me.
Okay,
Because
okay.
she says she didn't want me going up those steps and falling and breaking a hip.
Very understandable.
And so she fixes a plate and brings it down.
Okay.
So we used to use a bigger plate, but I cut down to a smaller plate. I said, don't use this one, it doesn't hold as much. So, but she's very good at that.
Oh, that's wonderful. That's absolutely wonderful. Now, Tyrone, like on day-to-day, what techniques do you find is the most useful that you feel?
The techniques that that I use is a 2-to-1.
The 2-1 ratio? Okay.
Yeah, because I tend to breathe in deeper, but I blow out, and as I exhale, I'll use.
Right.
I'll say Yahweh, and Yahweh is God's name.
Yeah.
So when I say that Yahweh is me breathing out more CO2.
Yeah, you know, it's funny when you say that. I believe in Alaska they have a saying, or it's like a seance type of thing they will do with their child, and or like a little baby to calm their baby down. And it's actually what they're actually doing when they say certain vowels to the way they're saying or pronunciating it, it will actually cause back pressure. Like if you're doing like, but you cause a vibration in your lungs, that helps remove congestion. If you're causing back pressure, that helps oxygen get past the semi-impermeable membrane through the alveolar capillary walls for the oxygen to go into the blood. So that's actually that's a really nice technique. Actually saying that, because you're actually causing back pressure, which splints the airways open, allowing more release of CO2 to come out from your body. So that's a really nice technique, really good technique. Does anybody have any questions that you can go ahead and actually write up any questions? They say, I always purse lip breathe when walking for more than a few minutes. Very good, Phyllis. Very, very good. Let's see, there's a lot of static. Oh, sorry, maybe my microphone's touching. I apologize. Yeah. All right, if there's any questions, we're going to wrap this up. So let me see if there's any questions on here. Oh, do you find any weather affects you with your breathing? So what would be the most optimal time to go out? Would it be cooler air, not as humid? What would you find that is the best day to go out with people that have hard time breathing? What would you say?
That is awful.
Awful, okay.
Awful. And real cold. You should, when you go out, you should cover your mouth with a scarf or something.
Yeah, produce an HME.
Because it is just so
Sure.
cold that it takes your breath.
Absolutely.
In the summer, it just feels like everything's closing in.
Yeah, with the scarf technique, what she's talking about is when you put a scarf over your face in cold weather, the moisture that comes out from your exhale, there's about 47 millimeters of mercury of water that actually comes out. So when you breathe onto, let's say, a scarf, it moisturizes and wicks through the scarf. When you rebreathe it back in, it re-moisturizes it. So if the weather out there is very cold and it lacks humidity, you're actually making what we call an HME, a heat and moisture exchanger, just by putting a scarf over your face. So a good technique, very, very good.
Yeah.
Now with
For
weather,
me, it's summer.
summer is the best?
No, it's not.
Oh, okay.
I'm a winter baby.
Okay.
I just had a birthday in December the 11th.
Well, happy birthday.
Thank you. I enjoy the cold.
You enjoy the cold?
Yeah. The summers, I'm not a fan of the summers as much as I am of the cold.
Okay.
And partly because of the breathing.
Sure.
Now, more so. Sometimes it feels like my throat is closing, in the summertime. And it seems as if I have to breathe in more.
Okay.
Even more than usual.
Do you ever try the apple technique?
No, he's getting ready to give me another one. What's that?
Well, if you eat an apple 15 minutes before going outside, remember we wanted to mention that?
Yeah, I did.
Yeah, if you eat an apple 15 minutes before going outside, it has to have the peel on it, but it actually has been shown to reduce wheezing by 30%. Dr. Oz actually stated that on his show, but us in Pulmonary, we kind of knew that, but actually you have to have the peel on it, so applesauce wouldn't work. It has to have the peel on it. But yeah, it'll actually reduce wheezing by 30%.
I remember that.
Yeah,
Yeah.
you told Dad after I did how many pounds of apples I sit and I baked them.
Oh, that's fantastic.
Well, Melanie said, well, you got to have the rind on them. And I said, well, you didn't say that.
Yeah, it has to have that on there. Let's see if there's any, when the barometer pressure drops below 29.3, I have more trouble. Also, high humidity, whether it's cold, hot or cold, makes breathing more difficult. Absolutely.
Yeah.
And Marianne Verderosa, the apple surely works. And I say, yeah. And everybody, thank you for tuning in for today. Can't appreciate it anymore. Right after this, we have a small segment I'd like you guys to watch. We have a bunch of patients actually playing harmonica. Now, mind you, that's not the sophisticated orchestra. Right. So just
bear with them.
Yeah, bear with them. But they gave it their all, and we can't be any more appreciative. Thank you. Have a happy holidays, and thank everybody for coming in today. Thank you very much.
Thank you.
Merry Christmas, everybody. Thank you.
All right, this is Jingle Bells. Everybody ready? 1, 2, 3, go. Merry Christmas, Alex. Merry Christmas, everyone. Great job. Great job.
Guys, they did an amazing job. We got to applaud them for that. That was an amazing job. Like I said, it wasn't, you know, it's not CD ready yet. we're not there on iTunes just yet.
Right.
But it's definitely, they give it their all. That was fantastic.
Well, see, you couldn't hear me.
Huh? Oh,
You couldn't hear me.
Oh, you can hear you.
No, because they mute me out because my concentrator makes so much noise.
Oh, I got you. Well, no worries. Thank you again, everybody. Have a Merry Christmas and a Happy Hanukkah. Happy holidays, everybody.